Hi everyone. For those of you that don't know me, my name is Mark Whiteside. I'm 49 years old, and I have HPV positive squamous cell carcinoma on the right base of my tongue. It's stage 3, and I'm in the second day of treatment right now. I'm going to try to, every day possibly do an update about what's going on with me. I can't promise I'll upload it every day, but I'll try to get it once a week anyways. Today is my second day of treatment of 35 radiation treatments. I got 33 more to go. This Thursday, so today's Tuesday, 2 days, I start my chemo treatment. So I have 35 radiation treatments and once a week chemo. And it's cisplatin they're using. Not a fan, but gotta do what I gotta do. Like I said, I'm going to try to upload videos about what's going on and with me and the effects that this treatment is having on me, which I understand can be pretty bad. I'm also, as time goes on, I want to show everyone what I'm doing to try to, if not prevent, then at least lessen these potential side effects of this treatment. I'm pretty sure I'm probably going to get dry mouth. The radiation tends to hammer the parotid glands, and I could get difficulty swallowing. There's a whole list here. Loss of taste, I'm pretty sure to get. Stiff muscles due to fibrosis from the radiation hitting them. There's exercises I'm going to do to try to prevent those, and I'll show you those at some point too. And all this, the dry mouth in particular, and I could get sores in the mouth, but this could lead to thrush, which is painful fungal infection in the mouth, mucositis, thick mucus, thick saliva. Again, I'm going to try to avoid all that if I can, or at least lessen it as much as possible. That's the radiation, and I think maybe to some degree the chemo, but the chemo is more nausea, potential diarrhea, peripheral neuropathy. The fingers and toes, having the feeling of pins and needles in the ends of your fingers and toes. And what else? I think that's about it. Well, loss of hearing. That's when I don't need any more loss of hearing. So let's hope that doesn't happen. Again, today's my second day. It's not bad. I mean, you go in there, they lock you down. 2 weeks ago, they made a mask that sits over to my face tight, and it's mesh, so you breathe through it. But it holds my head. They basically pin my head to a table, and they line it up with lasers. They put me in there. They do a CAT scan, make sure the tumor is lining up with where they think it's going to line up. I'm guessing this is what they're doing here, and they pull me back out, put me back in, and start hitting me with radiation all around. I talked to the doctor today, and he said it's mostly here and some through the back of my head into it. I don't know what that's going to do, but that's what they're doing, and that's what I got to do. So December 14th is my last day. I'm counting down to that day. So far, with only 2 in, I really don't feel anything. The biggest pain in the ass right now is this feeding tube that I have put in, and I'll show you that at some point too. I hate the thing. I never wanted it, but they're really insistent on you getting this feeding tube. It's not so much the pain, it's waking me up at night with spasms. It's just, and I got it last Wednesday, so it's a little less than a week that it's been in, and I just can't stand it. But anyways, it is what it is. Hopefully I won't need it. It's there. The purpose of it's there in case I need it, in case I get down the road and my throat gets so sore that I can't swallow solid food, or I can't even swallow, pureed food. But one thing I do have to do is keep swallowing water this whole time. So maybe maybe it'll get so bad that I need to just take sips of water and inject water into this tube. I don't know. I don't know. We'll have to see how this goes. But I will, like I said, I'll keep everybody up to date. I'll keep everybody informed. If you got any questions, post them in the bottom. I'll do what I can to answer those. And I'll see you guys soon. Hi everyone. Day 4 of radiation and my first day of chemo, November 2nd today. Chemo went okay. They give you a bunch of fluids beforehand, then they give you the chemo, and you're done. It lasted quite a while, just because of the amount of fluid they had to give, but it went okay. No acute side effects, no nausea or anything. So I'll know if it's, how bad it's going to be for me in the next few days. If anything, drastic happens, I'll certainly let you know and post, more video. As far as the radiation goes, like I said, fourth radiation treatment. I can definitely feel it on the tumor. It feels like a golf ball back there now, and my mouth is a lot drier than when I started. I got to constantly drink water, but it's all in all, it's going pretty well. I can feel that tumor, and I asked the nurse about it, and she said, it's a good thing. It's dying. It's necrosis, she said. So apparently that's good. Well, I guess the tumor dying is always going to be good, but it's going away. It's starting to go away, anyways. Just what I'm looking for. But other than that, everything's pretty good. I went to the gym this morning. I feel good. Nothing terrible yet. Hopefully nothing terrible in the future, but I'll let everybody know. Any questions, let me know. Okay, this first picture is just the tomotherapy machine. This is the machine they stick me into for radiation. You can see up at the front, there's my mask they put on. You get a better view of that next. There's a side view of me in the mask. They lock me down, and this is what really holds my head in place, so they can accurately hit that tumor with protons and kill it. Next one is just a downward view. That mask is tight, really tight. I can't really even open my eyes when I'm in it. And the last one here is just me about to go in. They lift the table up and shove me in there. It's not too bad though. I don't know. I mean, my eyes are closed. I don't know anything. And then it just clicks when it does the radiation. This last one here is me getting chemo. They just got you sitting in a chair there for, I think I was there 3 hours. This is actually, I'm getting the initial fluids, because they got the urn there where I got to pee in. I got to pee up to a certain level in that thing to prove that I have enough fluids in my body for them to give me the chemo. But it's pretty straightforward. 3 hours of just sitting there doing nothing. But it's better than cancer. That's it for this week. I'll have something uploaded again next week with my progress, and we'll see you there.